Does cold exposure therapy improve thyroid thermoregulation? Let's explore whether cold exposure therapy can enhance thyroid thermoregulation. The thyroid gland plays a crucial role in regulating metabolism and body temperature. It does this by producing hormones like thyroxine and triiodothyronine. These hormones help generate heat, especially in cold conditions. Research shows that cold exposure can influence thyroid function, but the effects can vary based on age, thyroid health, and individual differences. In studies with aging rats, cold exposure led to increased levels of thyroid hormones and changes in thyroid structure. This suggests that cold can stimulate the thyroid gland, enhancing its activity even without changes in thyroid-stimulating hormone levels. However, younger rats did not show as significant changes under the same conditions. In humans, thyroid hormones are essential for a process called cold-induced thermogenesis. This is how our bodies produce heat when exposed to cold. Studies indicate that individuals with normal thyroid function tend to have higher energy expenditure and better activation of brown adipose tissue when their free thyroxine levels are higher. This means that adequate thyroid hormone levels can help the body adapt to cold by improving heat production. On the other hand, people with hypothyroidism, or low thyroid hormone levels, may struggle with cold-induced thermogenesis. Moderate hypothyroidism can significantly reduce the body's ability to generate heat in response to cold. However, when these individuals receive appropriate thyroid hormone replacement therapy, their thermogenic response can improve. This shows that having enough thyroid hormone is vital for effective thermoregulation during cold exposure. From the perspective of managing cold intolerance related to thyroid disorders, cold exposure therapy might stimulate thyroid hormone activity and enhance heat production in individuals with normal thyroid function or those receiving proper treatment for hypothyroidism. However, for those with untreated hypothyroidism, cold exposure alone is unlikely to improve thermoregulation unless hormone levels are adequately addressed. While cold exposure can activate pathways that involve the thyroid and brown adipose tissue, it should not be viewed as a standalone treatment for thyroid disorders. Personalized medical advice and appropriate thyroid hormone therapy are essential for effectively managing cold intolerance related to thyroid issues. In summary, cold exposure can potentially enhance thyroid thermoregulation by boosting thyroid hormone activity and promoting heat production, particularly in individuals with normal thyroid function or those properly treated for hypothyroidism. However, the effects depend on thyroid health, age, and individual differences. Cold exposure therapy should be approached with caution and not replace standard medical treatments for thyroid disorders.